Okay, Peggy and Kiki, I don't remember who's going to go first, but feel free to take over.
Hello, good evening, everyone. Thank you all for coming. My name is Kiana Sowell. They call me Kiki. I am the Survivorship Nurse Coordinator for Advocate Christ Hospital, located in Oakland, Illinois. Tonight, we will be discussing understanding survivorship along with my co-host, Peggy Kupris, who's the Survivorship Coordinator at Advocate South Suburban Hospital. Next slide. So tonight's objectives will define cancer survivorship, understand the historical background of cancer survivorship. We'll also be talking about understanding the components of a survivorship care plan and treatment summary. We're going to take a, a brief overview of the survivorship programs. And lastly, we will describe the responsibilities of the oncology nurse navigator and/or survivorship coordinator throughout the survivorship continuum. Next slide. So definition of a cancer survivor. I think that this slide is very important. When I speak to my cancer survivors, they think that, oh my goodness, I'm surviving now that I finished chemotherapy, or I finished radiation, or a combination of them both, or when I finished taking some kind of oral hemooncolytic, or once I finished surgery and I've healed. But actually, per the National Cancer Institute, an individual is considered a cancer survivor from the time of diagnosis through the balance of his or her life. Family members, friends, and caregivers are also impacted by the survivorship experience and therefore are included in this definition, which I also think is very important. And from the time of its discovery and for the balance of life, an individual diagnosed with cancer is considered a cancer survivor. Next slide. So this slide, I know it looks a little busy, but it's a very important slide also. This talks about male and female and the numbers of cancer survivors. So as of January 1, 2019, for all sites for males, we had roughly 8.1 million cancer survivors. Now, if you just look right below that, on January 1, coming up, approaching 2030, same sites, same still male, we have almost 11 million survivors. I think that's awesome. And if you go over to the right, you have female, all sites. Back in 2019, it showed 8.7 million survivors. Then coming up and approaching 2030, we have 11.1 million survivors. So the good thing about this is that the number of cancer survivors, they're rising worldwide, which is great. And this is contributed to and propelled by early detection and treatment and prevention. Next slide. This is another slide that Peggy and I decided that we wanted to keep in here. So often my patients think that, it's only me, or it's only somebody who looks like me, or, who's surviving, this is a very good picture of cancer survivors, different ethnic backgrounds, Caucasians, African-Americans. Right here, we see at the bottom right, looks like maybe a retired community, they're survivors. Over here, right above that, we have a picture, it looks like they're at a baseball field. So cancer survivorship affects all different ages, all different races, and all different socioeconomic backgrounds. Next slide. So the changing demographics of cancer survivorship. The majority, which is roughly 67% of survivors diagnosed today, can expect to live equal to or greater than 5 years, and probably even far out than that. Treatments are increasingly complex and multinodal, so you're getting different treatments. For example, a breast cancer patient, maybe back in the day, so to speak, they would get one treatment, but today they may receive a regimen called adriamycin and Cytoxan, or doxorubicin and cyclophosphamide. Patients receive most of their care in the community-based outpatient settings, which I think is really great. It gives the patient some autonomy. Patients no longer have to be admitted into the hospital and tied down to a bed, or even a 23-hour observation. They can get treatments on an outpatient basis. And unfortunately, for many cancer patients, cancer is a chronic illness. However, we have so many different medications and so many different treatments and regimens to make sure that we take care of the patients the best way possible. Next slide. So survivorship, NCI definition, the National Cancer Institute, health and life of an individual from end of treatment until end of life. This covers the physical, psychosocial, and economic issues. It includes access to care and follow-up treatment, late and long-term effects of treatment, and secondary cancers and quality of life. And it includes family members, friends, and caregivers. This is a very important slide because some patients think, I finished treatment, I'm good. Unfortunately, with chemotherapy or surgery and even radiation, patients can have long-term adverse events or long-term side effects. So this is where Peggy and I come into play, that, we try to help you to navigate trying to get some relief for those adverse events or long-term side effects that you could potentially experience after having a diagnosis of cancer. Next slide. Little background information here. So the idea to perform a major study regarding cancer survivorship within the national academics originated with the National Cancer Policy Board. So the NCPB was established in 1997 and the Institute of Medicine, the IOM, at the request of the National Cancer Institute, the National Institute of Health, and the President's Cancer Panel. The National Cancer Board identified emerging policy issues in the nation's effort to combat cancer. The board then released a couple of major reports ensuring quality cancer care and improving palliative care. Next slide.
Did you go? Uh-oh, it's frozen. Oh, no, only twice. Okay.
Oh, perfect, that one. Okay, so the National Cancer Policy Board first reported and examined childhood cancer survivorship number of cancer we just recently saw on a couple of slides back. Completed by the Cancer Board, and the decision was made to assemble a separate and independent committee for the third report. The decision was made so that the number of experts needed to consider the important and various issues relevant to this large body of survivors could be included. Next slide, Peggy.
I changed it.
This report identified that the cancer patients transition from a structured system of care to a period with limited guidelines to help them navigate to the next stage of life. The IOM report, From Cancer Patient to Cancer Survivor, Lost in Transition, introduced the concept of a survivorship care plan, which Peggy will talk more about later on in the presentation. The IOM report identified 4 essential components of survivorship care. So early prevention and detection, cancer surveillance, intervention for long-term effects, and a coordination of care between the healthcare providers. The transition from active treatment to survivorship is a very critical period, and improvement in this period is necessary in order to meet the unique needs of the growing cancer survivorship population. Survivors often lack the knowledge to manage potential medical and psychosocial problems once they finish treatment. I think they're so used to going to treatment, whether it be for 6 months or a year. So when they are in survivorship mode and now they're going to get back to normal life, I think they have a difficulty trying to navigate that. And once again, this is where the oncology survivorship nurse, or like Peggy is the survivorship navigator, we come into play and we help them do that. Next slide. What survivors tell us? They want to know how to reduce the morbidity and the mortality associated with their diagnosis. They are also worried about the health as well as the impact that it has on their family members. So the cancer survivors, they're already trying to deal with fighting cancer. And then they're trying to deal with how they're being viewed by their family members, or if they're a wife of young children and worried about their children, or they have a husband, if they have a wife, they're worried about their spouses. So, they're worried about getting well from cancer, but they're also worried about the impact that it has on those whom love them as well. They want to work with their healthcare providers to address these issues, but they're often frustrated that these individuals often have little to offer them in this regard. Unfortunately, physicians, you can seem like the visit is rushed when you're with a doctor. So when you have time to talk to Peggy and myself or anybody else on your oncology team, you get a little bit more time to express these concerns. And of course, another thing that survivors tell us is that cancer, it kind of presented them with a teachable moment. When I talk to my cancer patients in particular, they often say, I thought I was living life, but I'm really living now, because now I know that life is precious, whether it means they change their diet, whether it means they start exercising, or whether it means now they often say they no longer sweat the small stuff. I think that them having cancer and they are surviving from the cancer, it really changed their perspective and their outlook on life. Next slide.
Oh, come on. I don't know why. There we go.
Okay. So I really like this slide as well. We often hear about, and no shade to breast cancer. So we hear a lot about the pink ribbon. They get pink tutus, they get t-shirts, they get parades, they get all the cool commercials. But as you can see, this is a cancer wheel with the ribbons. And it is important because, the pink ribbon is a well-known cancer. So, every time you see pink, whether it be a male representing for his wife or even himself, because, there is an incidence of male breast cancer, but then it's breast cancer, right? But if you happen to see a light blue ribbon, you may not know what that means. That could be a male who has prostate cancer or who is supporting someone who has been diagnosed with prostate cancer. Or the darker purple ribbon, that's for the myosarcoma or the pancreatic cancer ribbon. So I think, being cognizant, should I say, of this particular cancer ribbon wheel is very important, so that we can also support all the other cancers that people are being diagnosed with.
And the wheel is not all inclusive.
Correct.
Kiki and I, when we were looking at this, found that it's missing colon, it's missing head and neck. So it's just a sampling of all the different ribbons that are out there.
Just so you can know what other ribbons have a different symbolic color. And just so you know, there's more than one ribbon besides pink.
Mm-hmm.
So this is actually the first half of the presentation. It went by kind of fast. So if you guys have any questions, I saw some questions popping up in the chat box. So I'm going to go ahead and take over with the chat, and then Peggy Kupris from Advocate South Suburban Hospital, she's going to present the second portion of the actual presentation.
So I'm Peggy. In addition to being the survivorship navigator at South Suburban Hospital, I am also a 20-year cancer survivor myself. So I know how important, I always felt that we were taken, like Kiki kind of addressed it in her previous talk, we're taken such great care of during treatment. And then when we're finished, it's like, okay, call me if you have a problem. We're used to someone checking our blood, checking our scans, checking everything every 2 to 3 weeks. And then it's like, see you in 6 months. So that's where survivorship steps in. At the end of treatment, when treatment is all over, survivorship care plans have 2 parts. The treatment plan and summary is a summary of everything that you had. It talks about the type of treatment. It talks about the days that they were started and the days that they were stopped. That's important in radiation. You can only have so much radiation in your lifetime. So the treatment summary will include how many days you had radiation, what your total dose was, and what parts of your body were dosed. So like say in breast cancer, you're not just getting radiation to the breast, you're getting it to the lymph nodes as well. Same thing with prostate and colon. You may not just be getting it right to the area where the cancer was, you may be getting it elsewhere. For the chemotherapy part, it talks about what agents were used and what the total doses were. And the reason the total dose is important is some chemotherapies can cause long and late-term effects. Anthracyclines, which are adriamycin, can cause some cardiac issues that can come back to get you at any point in your life. So those patients are going to be followed yearly with an echocardiogram. So total doses are important because you can only get so much of them in your lifetime. Your genetic history is important. On our care plan at our hospital, it has the genetic history, but with genetics, it's forever changing. What they tested 10 years ago, they're testing twice as many genetic mutations now. So if a patient or a family member had testing 10 years ago, the genetic counselors may recommend that you get retested for the new mutations that we've identified. Any serious side effects that you might have had during treatment, people who had reactions to their chemo drugs or had some cardiac issues, that needs to be recorded. And just to explain, these little documents are kind of nice documents. If you think about how thick your chart would be if they printed it out, probably more like this. This is a brief summary. They're still going to want, if you have to switch doctors because of insurance or whatever, they're still going to want copies of your original documentation, but this is a nice summary for them to see what could be going on with you right now. If you had any clinical trial, if you were in any clinical trials, that information would be on there also. The other part of it is surveillance. So what's on the care plan is what tests you should have, how often. Cancer, for a lot of the cancers, have kind of gotten away from scanning constantly, because scanning is radiation, which can increase cancer risk itself. So in the old days, we used to do CT, CT, CT. We're not doing them as often now as we were. Some cancers, you still have to have it. Breast cancer, for instance, the rule of thumb is the gold standard is mammogram. So some people who are at higher risk might have a mammogram and then 6 months later an MRI, then 6 months later a mammogram. Prostate cancer, some of your colon cancer, some of your gynae cancers, we can track your blood levels to see if your cancer is coming back or increasing. Most things that we surveil is you reporting symptoms to your doctor. So the average cold lasts used to be 2 to 3 weeks. Now it's more like 3 to 4. But with that being said, your cold starts out, goes up, gets worse, plateaus, gets better. If you have a cold that lasts longer than 3 weeks and is not getting better, is getting worse or staying the same, you want to let your doctor know, because we'd rather do a chest x-ray and find out that, yes, it is a cold or pneumonia or bronchitis or whatever, than for you to come 6 months or a year later and say, oh my gosh, if you only came 6 months earlier, we could have helped you. Same thing with bone pain. If you have excruciating bone pain that came out of nowhere, that doesn't respond to the normal ibuprofen or drugs that you take, you don't remember falling or having any injury, you want to let your doctor know that. Indigestion, if all of a sudden you can't eat and you're getting nauseated when you're trying to eat, you want to tell them that. Severe headaches that you didn't get before. If you didn't get migraines before, now all of a sudden you're getting them, or a change in your vision, you have blurred vision. You want, or change in balance also. You want to let your doctor know. So surveillance in cancer is a lot of you self-reporting symptoms that you might be having, and you want to let your doctor know. So in the care plan, it kind of tells you what you want to look for based on what treatment you had, what tests will be ordered for you, how often you should have them, and which provider will be recording it. Should it be your medical oncologist, your surgeon, your radiation oncology? Most cancers, your oncologist is the person that you go to with anything out of the ordinary, because that's the one that's going to be following you the longest, and that's the one that the chemotherapy is the one that can affect different things in your health more than some of the others. The follow-up plan depends on the type of cancer. So the survivorship care plans are very personalized to what type of cancer you have. So there's not just one type of breast cancer, there's many. So it's personalized to that. Same thing with gynecological cancers, it's personalized. Prostate cancers, it's personalized based on your stage. So everything is geared towards you and what treatment you had and what your cancer was. Also within the care plan, we do give you a copy. We copy and put into the care plan your pathology report from your initial diagnosis. And if you had surgery, your pathology from surgery is included in there as well. Support. So then in the follow-up care, we also tell you supports services that are available for provided that we have at our hospital or that we might refer you elsewhere. Late and long-term effects of cancer. So radiation and chemotherapy, even surgery sometimes can carry late effects, which means it happens later down the road, or long-term effects, which mean they kind of never really go away. For instance, one of the biggest things people complain about that is a long-term effect is fatigue. It can last, some people say it lasts forever. Fatigue for me was the most frustrating thing because I feel like it didn't stop me from doing anything, but it took a lot more out of me to do the things that I normally did. And people think that, survivors think that, and family members, once we stop our treatment, a light switch gets turned off and you're back to normal. That doesn't happen. It takes a long time for you to feel. So I used to work in surgery, and we used to tell patients, and I worked for a plastic surgeon as well, we wouldn't do any scar revisions for 2 years because your body's constantly healing for at least 2 years. So the same thing happens if you think about chemo and radiation. They're kind of causing invisible scars, but they are working on the tissue. They're doing their job. They're killing that cancer. And while they're killing the cancer, they're killing some of your healthy cells as well. So please be patient with yourselves, depending on where you are in your healing process, but it is an ongoing thing. Another thing that's really important that we touch on and we spend a lot of time on is your other health issues. When we're being treated for cancer, a lot of patients forget about their high blood pressure, forget about their cholesterol, forget about their diabetes. These can all be affected. So in breast cancer, for people who are taking the aromatase inhibitors for 5 years, those can affect your cholesterol. They can also affect your bones. So we're going to be concerned about your bone health. Radiation, people who have head and neck radiation, it can affect your carotid glands. So we're going to check your carotid vessels, your arteries, to be sure that you're flowing right so you don't have a stroke down the road. And same thing with any other part of your body. We're going to be checking and watching for those things to be sure that you're not having any of the late or long-term effects. So there's a lot of physical changes that happen with chemo. It's sometimes with cancer treatment, sometimes it happens and not everybody gets everything. Some is caused by the treatment. Some we're finding is caused by the inflammation caused by the cancer diagnosis itself. So fatigue, memory and concentration changes. So those are often called chemo brain, but we find in research that even people who never had chemotherapy get chemo brain, get that fog, the brain fog, where you can't remember things or you can't find that right word right away. There are also studies being done to link it to PTSD, like a PTSD. I mean, let's face it, who ever thought in their wildest dreams that you would hear cancer associated with your name? So it can set off like a PTSD. Pain, some surgeries, people get pain forever. Neuropathy can be caused by the chemotherapy, can be caused from some types of surgery. Lymphedema is swelling of a limb. So breast cancer patients can get it in their arm. When I started in surgery many, many years ago, we saw lymphedema a lot in prostate patients because when they removed the prostate, they would remove all the lymph nodes in the groin. And these men would their legs would swell up with lymphedema and they'd have difficulty walking. We found that that wasn't necessary. So treatment changed and doesn't have that anymore. Radiation and some chemos can affect your dentition. And so if a person starts having bone loss because of the medication they were on, or if a person has metastasis to their bone, they are given medications to strengthen the bone, but some of those medications can weaken the teeth. So it's very important to stay on top of your dental health. Changes in weight or eating habits. Everybody always they always assume that they're going to lose a ton of weight when they have cancer treatment. Very often people complain that they gain. Now, depending if it's something that affects your GI tract, you will lose, or your head and neck. But most patients complain about weight gain because of the steroids that they're put on to help stop the nausea and vomiting during treatment. Difficulty swallowing comes in with the radiation of the head and neck. Bowel or bladder issues, and then menopausal symptoms. Almost all chemotherapies put women who are premenopausal into menopause. Depending on your age and depending where you were in that cycle before you went on chemotherapy, it can come back, but a lot of people it doesn't. Before, we didn't have the option to talk about fertility. Fertility is a big thing to talk about up front now for younger patients, male and females, because they can freeze eggs alone. They can freeze fertilized eggs. They can freeze sperm so that later in life, if someone wants to have children, they can still have them. Emotional effects are really important. Our country does not give credence to what is needed for emotional. We kind of look and put stigma on emotional support. We don't want to save your life and prolong it and make you miserable in the process. So there are counselors out there. Gilda's has many support groups. Support groups are great because if you don't feel like talking, you can sit on a support group and you can hear what the others say, and you don't feel as alone. You feel like, I'm not crazy. I'm not the only one that feels that way. Other people are going through the same thing. So support groups are wonderful. There's also organizations that offer free one-on-one support. There's organizations that'll hook you up with other survivors, your age, your diagnosis, your treatment. So talk about it. Find someone in your life, family member, whoever, that you can talk about, because worrying about your health is very normal, but don't keep it in. Talk with others, because sometimes when you don't talk to someone else, it seems worse, and you think the worst instead of seeing it improve. Be active, get out and do things. You guys are taking a great step forward by participating in these lectures. This is a great way to do it. Find ways to relax and reduce stress. Exercise. Exercise is a wonderful, if you get your endorphins going and you feel better, but exercise also will help with that fatigue we talked about a few minutes earlier. You would think it would make you more fatigued, but because it pumps up your endorphins, it'll get you going. Gilda's has great exercise programs right now. We can do them online from the comfort of our own house. We don't even have to change out of our pajamas to do it. Support groups again, and then focus on what you control. There's a lot that's out of our control, but there's a lot that's within our control. Ever since I was diagnosed with cancer, my favorite saying now is, not my circus, not my monkey. I can't control what other people are doing. I can only control what I'm doing. So don't worry so much about what my next door neighbor is doing, or that my son's not cutting his grass the way he should, or other things, because I can't control that. So social and work relationships. Cancer can change relationships. Some patients find that people who were their closest friends are no longer their friends. My very good friend during treatment didn't know how to talk to me about it. So what she did is she pulled away, and I never heard from her till like 2 years later, because she said she didn't know what to say. So relationships change. And on the other hand, I had people that I didn't even know cared about me. I mean, we were acquaintances, but that was it. And those were the people that were at my side and helping. So you kind of learn about it. Families can be unprepared for the fact that recovery takes time. I talked about that a few minutes earlier. A lot of people, coworkers and family members think, okay, you're done with treatment. You should be back to normal. Why are you still tired? Why do you still not feel good? Why aren't you getting up and doing things the way you did? People don't understand. Let your family members know what you're able to do as you heal. It's very hard. Cancer takes away some of our control, and that's hard to give up. So I know, like, when my mother or sisters were offering to help me with housework and stuff, I kind of didn't want them to, because I wanted to still do it myself. Let someone else do it for a while. Take advantage of that. Give yourself time to heal. Give yourself time to get back into things. And be open and honest with yourself and your physicians and your family members and coworkers to get help. Research shows that cancer survivors who continue to work are as productive on the job as other workers. So people used to think that you had to take off work because you wouldn't be able to function. Now, some jobs you can't function. And in this day and age, with what we're going through right now, when you're going through chemo with a very low count, it could be dangerous to go out there and get into the workforce, because now you're at a higher risk of developing COVID. So you have to look at all of those things, but there's no reason why, if you feel up to it and you have a job that can do it. I have a lot of patients right now that are working completely through their treatment because they have the luxury of being able to work from home. So that's the new thing now that we have. Patients can speak with their employers about their needs. There's a wonderful organization called Cancers and Careers that will tell you what your legal rights are based on the size of your company. So any companies that have 100 or more employees have to order FMLA. Some employers pay for family medical leave, some do not, but anyone that has more than 100 employees has to offer it. So you can go on Cancers and Careers and find out what you would be entitled to. They can even have a section where you can ask questions, and there are attorneys that work on this, and they will answer you. They won't represent you, but they will tell you what you're legally entitled to. Cancer is a disability. Didn't used to be. Now it is considered a disability, so you can get disability. You have to fill out the paperwork, and there's work to it. But if you're in active treatment, you can get disability by having your oncologist or whatever. So if you're having surgery and you can't work, it would be your surgeon that fills out the paperwork. If you're in chemotherapy, it'd be the chemo that the oncologist that do it. And same thing with radiation. It's who's ever treating you at the time would fill out your FMLA papers and your disability. Accept help from people. We tend to want to do everything ourselves. It's okay to ask if people offer to help. Give them something specific that you could need help with. Have a plan for what you say about your recovery. That's about your cancer. That's kind of about people in the beginning phases of survivorship. A lot of people don't know what to tell their coworkers. I have a lot of teachers who ask for help on what to tell their children that they teach. So a lot of people don't want to tell their grandchildren or other things. So think about how you're going to and who you're going to tell and what you're going to tell them. And keep in mind that when treatment ends, the warrior and your family often are not prepared for the fact that recovery takes a very long time. In general, your recovery will take longer than your actual treatment did. People often say that they did not realize how much time they needed to recover. So I put this in there because I feel that's very important because it does take time. General information and education. Kiki and I cover nutrition, the importance of a healthy diet, low fat, and little to no alcohol. So women should not drink more than 1 alcoholic beverage, so a 6-ounce glass of wine a night. Men can have 2, but now they're even saying that you shouldn't have any because alcohol can affect your DNA and put that little chink in your armor and that's where the cancer will get in. So they're saying no alcohol. And even that 1 drink or 2 drinks, you can't save all of them up and have 7 on the weekend. You can't do that. It still should be 1 a day. You want to take care of your skin. So after chemotherapy and radiation, a lot of people are very sensitive to the sun, and that can last up to 2 years or longer. So you want to be sure you have sunscreen on and you're protecting your sunglasses, a hat on your head. You want to just really be careful with the sun. And also, many years ago, people of color didn't get the skin cancers that we're seeing now. We're now seeing an increase in skin cancers in darker skinned people. So you still want to be cognizant of that and use sunscreen or long sleeve shirts, hats, sunglasses. Life after cancer treatment, be aware of your feelings, be able to talk about your feelings to other people and know, like I talked a little bit about signs of recurrence and signs of that it went somewhere else, headaches, colds, bones, things like that. You want to have, if breast cancer patients want to have their yearly mammograms, you still want to have colonoscopies. All of your healthy men want to have their prostates followed by a physician. The biggest thing too, another big thing is financial concerns. And sometimes the financial concerns may not hit us while we're in treatment. We may not even realize the bills that we're going to be hit with till 6 months or a year after cancer, when those bills start coming in. Most of the hospitals, a lot of the hospitals have financial advisors now that you can go and talk with them, set up financial plans. Also, they may be able to help you find grants out there, funding. One big thing that I always share with my patients is So that Good RX that you see advertised on TV, my husband's a pharmacist, he'll probably kill me for saying this, but Good RX really does help with lowering the cost of your drugs. So you can get, you can Google it online and get a card, and then almost all the pharmacies, Osco, Walgreens, CVS, they all accept it, and it will give you a lower cost. Also, for your higher end drugs, if you go online and search the drug companies, so say Pfizer, for instance, if your drug is made by Pfizer, if you go to the Pfizer website, a lot of the drug companies have financial assistance, so they might pay your copay. For an example, I have a nephew who had a brain tumor, and his treatment was going to cost him, after his insurance, $10,000 a month out of pocket. So I said to the social worker, is there something we can fill out? And he gave us the paperwork. We filled out the paperwork. He paid $10 a month. So it's always worth checking the company. The most they can tell you is no, but it's always worth checking to see if they can lower it. Each institution is a little different how they do their survivorship care plans. Survivorship care plans take a lot of time. It takes about 2 hours, an hour and a half to 2 hours to create the care plan. And if you multiply that times Kiki's 400 plus patients and mine, and one person doing them, it's kind of hard to do them all. So usually it's stage 1, 2, and 3 that the care plans are created for. Right now at Advocate, we're all doing survivorship care plans on breast cancer patients because that's our biggest population. That may change in the future, but right now that's where we're at because most of the survivorship navigators are doing other jobs because of COVID. So that's why we're kind of doing this. Some sites have survivorship as part of their navigator role. So if you're at a hospital where there was a navigator, you can ask the nurse navigator. I have a dual job. I'm a breast navigator and survivorship coordinator. So I really only do survivorship half time. The Commission on Cancer, who accredits the hospitals, they would like to see all survivorship care plans done within 6 months of finishing treatment or 1 year after diagnosis. It usually ends up to be 6 months because usually the treatment is taking much longer than the year, especially for patients who might have to take some immunotherapy or something. So those do come up, those do take a little longer. So the responsibilities of the survivorship coordinator or navigator, if you want to call them, is we meet with the survivor after the care plan is done, and we support them. We give this distress screening tool that you might have had at the beginning of your treatment, and what that does is it asks questions to see where you might, it helps you evaluate where and do an audit on where your stress is increasing. So then we can help try to find you help with that resources. Educating about the long-term and late effects, including psychosocial issues, the screening intervals that you'll have to do. We refer patients to resources within or outside of your institution. So Gilda's Club and many other organizations in the area. We complete the treatment summary. Right now, we complete them, we mail them to the patient, then the patient calls when they get them, and we set up an appointment to review them, and we're doing it virtually. It seems like even when we kind of were going back in person for a short while, patients prefer doing it over the phone or over Zoom so that they don't have to get in the car and drive somewhere and park and everything else. Facilitates survivorship support groups at Gilda's Club. When it's open at Christ, there's always one of the navigators working in that group with Gilda's social workers. So they work hand in hand. They're very blessed at Christ to have Gilda's. So I want to thank you. Healing doesn't mean that the damage never existed. It means that the damage no longer controls our lives. So these are 2 websites that so if you're further out than that amount of time that I told you, these are 2 websites where you could print out a survivorship care plan and bring it with you to your doctor, and you could fill most of it out yourself, but there's going to be your total radiation you may not know, or you might not know what chemo you had and what doses you had. So you can print those out from online, and you can fill them out yourself and bring them. So Livestrong was the first organization that started care plans, and they're really, you can say what you want about Lance Armstrong. I don't agree with everything that he did, but he brought survivorship to the forefront. He's the one who brought it to the Institute of Medicine. He's the one that pushed for survivorship. So his organization started the first care plans and started those programs. So that's what that one, the Livestrong one is. That one's pretty, it's long, it's pretty inclusive. There's a lot of information on it. And then there's the OncoLife also, that's online. And you could probably also Google survivorship care plans and find some other ones, but these are the two that are most commonly recommended. And then there are some of our resources. You'll see some of our resources are older, but that from cancer patient to cancer survivor, that's still the Bible of survivorship, and it hasn't changed at all from 2006. Treatments have changed, but as far as what's important in survivorship has not. So that's why it looks like a lot of our stuff is old. Kiki was presenting some the newer things, but like our definitions are old because they haven't changed. They're still the same. So if anyone has any questions, you can unmute your mics and ask us. We're happy to share the knowledge, because by asking, it's hard to read the chat. So not everybody might be following what's on the chat. So if you have any questions and you feel comfortable, please do open it up to the floor so others can hear.
I know, Peggy, a lot of people wanted to know if they can get the presentation and the slides, and I believe
Yes.
Jasmine is going to make sure that those who wanted it can definitely have access to it.
Right. Jasmine asked that they message her so she knows who wants them, and she will get them to the people who want them.
Perfect.
No other questions? You
Right.
guys are quiet
Yes.
tonight. You are not usually this quiet.